wish you a fruitful conversation.
Okay, thank you, Paulo. Welcome all to the Health Data Global Hybrid Summit. My name is Pedro Cides, and I'm the host for this session. The theme for this session is Health Data Revolution and the importance of dynamic ecosystems for virtuous growth. So with me, I have three distinguished speakers. Andy Bleeden, the Director of Ecosystems and Memberships at the European Connected Health Alliance, the Global Connected Health Alliance. Then I have Frederick Levins, the Vice Executive Director of the International Society for Telemedicine and eHealth. And also I have Levi Shapiro, the founder of the eHealth and also the digital health instructor at the Hebrew University of Jerusalem. So the rules of this session are very simple, okay? So each speaker will have, let's say around 10 minutes, okay, to present the ecosystem they represent, its objectives, okay? Also, of course, the profiles of its members and other relevant characteristics that are essential for a sustained and informed growth dynamics, okay? We will start with Andy, then move on to Frederick and end with Levi. So just a short introduction. In the current context of the pandemic, words such as solidarity, collaboration, internationalization, scale, professionalism, and ecosystem, among others, have gained a new importance and relevance. So in the previous sessions, we have noted that there are challenges in aligning policy decisions, the needs of patients, the priorities of health professionals, and the ambition of companies with products and services for health and healthcare. So the question is, how can these professional ecosystems help? So, Andy.
Thank you for that, Pedro. I wonder if you could be kind enough to make me the host so I can share some slides, which may help. Is possible?
Okay, let me just.
I do like this whole new experience with the Zoom now, that you see people in that sudden frame of mind. Oh, it's me. I need to, and you see their eyes go from corner to corner.
Yes,
it's just nice.
Sorry,
it beats the old days when you used to have to drop your slides on the floor with the overhead projector.
Yes, let me just see, because I. Okay, make you okay. Just confirm, Andy, please.
There you go. So a little bit about us and what we do, and our approach and our community and our ecosystem network. As was said, my name is Andy Bleeden. I'm the director for our ecosystems and membership with the European Connected Health Alliance, also known as the ECH Alliance. We've been around building ecosystems since back in 2011. I joined the first one back then because I was impressed with the model. My background's in social care and health. I've been so since the very early 90s, start of the 90s. Just a little bit about us. We're a member organization, okay, with about 750 organizations, different types of organizations, policymakers, patient groups, companies, etc., as well as researchers and health and social care professionals. We also have a large community of around 16,500 professionals within digital health and social care. We ourselves are a not-for-profit organisation with a base in both Dublin in Ireland and in the UK. So as a European Connected Health Alliance, we very much want to remain and maintain our strong and long-term links with Europe. We are a global organization now. Global in terms of reach, from Argentina all the way to Australia. Our product that most people know us for is our network of ecosystems. These are helping many digital health professionals connect up the dots with all the other stakeholders in digital health and social care in our ecosystem network. We also provide a variety of roles around comms and networking and events and funding, and some member support as well. People join us for the following reasons. I don't need to read these out to you, but they join them basically to make connections. And that's the secret goal, the sticky sauce in running ecosystems, is around connecting the dots between your organizations and your members. But they also join us to raise the profile of their organization too. I'll give you an example of the type of membership we have. And I wanted to just drill down, because very often we concentrate on corporates or universities or healthcare professionals. But I start where I began, with our current members who are patient organizations. We have both local, regional, national, and also European-wide patient organizations that are members of the European Connected Health Alliance. Why is that important? Well, because they're the center and the heart of our ecosystem network. We run a series of ecosystems that are permanent multi-stakeholder gatherings of all the professionals you see in the circle in front of you, whether it be from the research world, from corporates to funders, to NGOs to voluntary groups, from nursing organizations to social care professionals. But at the center are patients and citizens. These ecosystems are built around very, very basic concepts of breaking down the silos that are even more prevalent now in digital health and social care than they were when I started in 1990. Probably because of these things, we share less information, not more. Because of the thing we're sat in front of now, we observe less and learn more, learn less than we used to about what's around us. We're also starting to see silos within organizations as well, not just between them. But the other thing our ecosystems are very much involved with is this idea of transforming health and social care delivery. Because ecosystems shouldn't be talking shops. They should be places where people do things. That leads me on to the third element of our ecosystem network, which is that we all are lucky enough to live in countries where the majority of our government spending is spent on health and social care, or a large chunk of it. So that means there should be a large economic opportunity. And we want to use our ecosystems to both create and exploit that economic opportunity. All our ecosystems are different, and I'll show you where they are in a moment, but they're all based along the following principles: that they're a geographical focus, they should be free to attend, because otherwise patient groups and citizen groups and user groups won't turn up, neither will SMEs. They should be accessible, okay? The other thing is they should be like governance. They shouldn't be things with minutes in and long reports. They should be doing places where things happen. The very minimum is people connect with each other. But they should lead with a need. They shouldn't be necessarily demonstration places for new technology. You should find out what people want first. That's why patients are at the heart. So Paul referenced right at the beginning of this that they've become our second Portuguese ecosystem. So I'm really proud of, especially with the upcoming presidency of the European Council of Portugal. But you can see in front of you where our ecosystem network is spread. We're about to launch our 50th ecosystem this year in India. COVID has led to some very strange times in terms of all member organizations. But what it's meant for us is we have seen enormous growths across Latin America and outside of Europe in our network of ecosystems. And we're shortly also to launch our first ecosystem in Israel, as well as other examples in Uruguay and hopefully in Colombia. Our ecosystems join our network. They may already be existing clusters, but they seek to work with us to collaborate, scale up innovation, increase access to international markets, but also bring in the best practice, because we don't know it all. And I think as soon as you start thinking you do, it's time to get out of the healthcare profession. But they also join us because they want to get involved and connect up with 40, 50 now ecosystems globally, because they usually want to collaborate, and that's a strong thing. Now, there was reference made just now to the pandemic and the need for global collaboration. Never has been such a time as now as the need to collaborate globally. And we've been proud to launch our Global Connector Partnership, both with colleagues from Africa, India, the Commonwealth, but also in America and Latin America as well. Because we think a pandemic of the global proportion we're seeing now needs a global response. That's a little bit about us and our ecosystem network and our approach. I'm happy to discuss with all of you. I'm going to hand back the hosting now by pressing the big red button at the top.
Okay.
I can barely see.
Thank
There
you.
you go.
Thank you, Andy, for your presentation. It was very, very interesting, and for sure, not easy to align all those different ecosystems and geographies. Frederick, let me see if I can give you here the control of the system, like I did. Okay, just 1 second. Okay. Andy, sorry, you returned the. Sorry, I can't hear you. Andy, sorry.
Yeah, what you need to do, go to participants.
Yeah. I'm there.
Frederick
So.
Leedens, more, make
Yeah,
co-host.
I'm there, but it's not.
Frederick, over to you.
Yeah. Okay.
Okay.
Let me just share these slides as well. I only have a few. I'm actually going to do a bit of copy paste with what Andy was saying.
We
because
charge for that.
I'll briefly introduce the International Society for Telemedicine and eHealth, the ISFTH, to you. And yes, we are an international global network of telemedicine and eHealth, digital health stakeholders. So obviously, we're very much in the same space, or we have same and similar aims as the ECH Alliance, which obviously we know very well, and there are links between us either by people who are members in both of the organizations, or we meet each other on and off at events. I remember meeting Brian O'Connor years and years ago when I think the ECH Alliance was not yet up and running, but he was thinking about that and working on that. And obviously next to the both of us, our two organizations, there are many others, and it's all worthwhile and valuable, because we are indeed in that space of sharing knowledge and experiences when it comes to the to telemedicine and eHealth, digital health, and especially I would say, and I fully agree with you, Andy, the practical implementation, the practical application, and making sure that it is being done in a manner that serves the end users, the patients, the people, citizens, healthcare professionals, and so on. And so our society was actually born out of a number of health professionals who in the early to mid 1990s were heavily interested and invested also into this, at that time, well, still relatively new way of providing care or providing diagnosis, et cetera, et cetera. When I say mid-90s, that was before the mobile phone and other mobile technologies and so on. So it was still, if we look back at it now, a little bit of the Middle Ages of telemedicine and eHealth. But gradually it grew and it became established as a federation of national associations. And so in the meantime, we have grown to a network of about, well, it depends because we have various levels of membership. So there are national member associations, we have institutional members, which can be healthcare providers, universities, research centers, and so on. There are companies, there are also individuals who in their own name and out of their own interest are members. So we have about 500 members in total over about 100 countries, and so I think there certainly is also some complementarity with the ECH Alliance, where we have also a lot of contacts, members in Africa, in Asia, Southeast Asia, etc. But obviously also in the countries and the regions that you were already mentioning, Andy. And so it's this wide and diverse network, and the main aim initially and still now has always been to foster that networking and the sharing of practical and concrete knowledge and experiences among healthcare providers, researchers, business people, developers, also users, patients, organizations, etc. Because in the meantime, obviously, a lot of experience has been built up. A lot of medicine telehealth services are being provided. Of course, what we have seen now since the beginning of the year or since March is a boom into the use and the interest for telemedicine out of let's say, a sheer need of doing it that way because of the need for social, physical distancing, etc. So this has definitely had the benefit of bringing the topic under the attention also of the let's say the general public, for whom a lot of this was far away. They weren't quite sure that it existed or what it was about, and now a lot of the people that I know who weren't in or aren't into telemedicine as such, and now really had firsthand experience with an online telephone or video consultation with a general practitioner or with a specialist, etc. So it has really come very close to everyone's daily life. Now, what that will mean for the future is still a question, whether it will just like that remain the standard. I think there's still a lot of things to be resolved in terms of how you organize this, how you provide this. There is now temporary funding and reimbursement. All that all of a sudden was possible, but to do it in a structural and sustainable way still requires some work. But there again, organizations like ours can help to bring the good practices that are out there together and to help it make it reality into the future as well. So the networking, the sharing of information and knowledge is certainly central to what we were doing, what we are doing. But we're also looking now more and more to some practical services in terms, for instance, of the assistance of companies, industry representatives who want to move into new markets, to help them with registration requirements, etc., with regulation. The same thing when it comes to quality certification or accreditation of telehealth services. This is a topic that we have received in the last couple of months, but also already before COVID, questions around and interest for. So also with some of our members and partners, this is something that is in the pipeline, as well as professional individual certifications of people who want to become better acquainted with digital health technologies and so on. These are just our contact details, website, and so on. And so that was really just the couple of slides I wanted to share. Just a few final things when it comes to health data, and this is also something we've seen again in the last couple of months, that of course when you do distance consultations, often with a health professional that is not your own GP, your own family physician, you need to have a good backbone of a health data and a patient data system where the healthcare professional who may not have seen you before has also good access to your medical history, etc., etc. So this is something that that definitely it was already in place in some places, in some countries, but we also see that it still needs and can be done in a much better way, because that data is at the basis of good healthcare provision, and so it needs to be made available in a safe way, in a secure way, needs to be accessible, and needs to be able to be shared among those who need to have access to these informations when treating or dealing with the patient, with the citizen. And then I think all that data that is being gathered, that is being stored, certainly can also have a very, or can be a positive thing in let's say, secondary use of data to aggregate these things and make them available to drug developers and other treatments, etc. So yeah, a lot of that's where let's say the telehealth, telemedicine services and the health data really come together and strong, or form strong alliances in many different aspects. So these were just a few basic introduction, a few thoughts and ideas, and happy to discuss further.
Okay, thank you. Thank you very much, Frederick, for your sharp look about these days, and it's good to know that even with the context of this pandemic situation, you are very positive and dynamic about the ways to solve some issues and to give an updated value proposition for your members. Okay, so let's pass to Levi. Let's see if now I can give you the controls. Okay, the stage is yours, Levi.
Sure. Are you seeing my screen? You are screen sharing. Just confirming you can see my screen.
Yes, I can see you.
Very quiet.
Yes, you can. Can you turn on your phone?
Oh.
The volume, and
now you can hear me very well. Yes.
Not really, Levi. Not really. Sorry.
Okay.
It's the volume of your microphone, Levi.
Okay, let's try that.
Now it's good.
You can hear me okay now?
A little better, yes.
Okay, let's do this. Is this better? Perfect. And can you see the visual that I have on the screen?
Yes.
Okay, so now that we've taken up about 20% of the lecture, I will, I appreciate the introductions from Frederic and from Andy, considering that they did a great job of providing details about leading organizations. I decided maybe I would pivot a little bit in the discussion. I still want to introduce the organization that I founded and run. It's called eHealth Israel, created about 8 years ago. It's basically the IT and health care worlds addressing transformation, and we are supporting that effort. So even though we're a very small market, this organization has about 8,500 members in Israel. Very frequent activities, just like your other organizations. and active on social media. So that's who we are. We have an accredited weekly academy. Hold on 1 second.
Dear friends, I have to interrupt your session now, dear friends, because we have to start the live streaming for the Facebook now. And but you're kindly invited to go to a different room, Levi and Pedro. Maybe you can choose pick up breakout one, and you keep your conversation there.
Okay, so let's skip to breakout.
Breakout one, please, because you have a lot to talk, I'm sure. And we need to clear now for a Facebook transmission. We have to start live.
Okay, thank you all. We'll see you in the
when you finish,
room.
please join us here, or I'll join you there.
Okay, thank you very much.
See you then.
Thank you. Thank you, Levi. Let's all go to the room one, right?
Thank you. Thank you so much.